Hi, everyone. Good afternoon.
Hi, Susan. Good to see you.
Good to see you, Jen. I know it's 1 minute past the hour. I apologize for being a little late. I am on service, and as it goes, things kind of blow up unexpectedly, but why don't we get started? So, my name is Susan Wong. I'm one of the neonatologists at the Anschutz Medical Center, co-director along with Dr. Tina Fisher of our Define Quality Improvement Collaborative, focused on improving family engagement during prolonged NICU hospitalization. And this is our quarterly webinar. I am thrilled to welcome Dr. Genevieve Guyol, who is an assistant professor of pediatrics at the Boston University School of Medicine, but in addition, assistant professor of teaching and learning at the Boston University Wheelock College of Education and Human Development. She's an attending neonatologist at Boston Medical Center, which is a safety net hospital in Boston. And I honestly cannot think of a more skilled individual to present on this topic around shared reading and establishing and supporting early relational health in the NICU and after discharge home. It's been truly remarkable to see Jen's early career blossom and her service to the community and really fostering dyadic support of families during prolonged NICU hospitalization. So I will hand it over to you. If folks want to chat in questions, I'm happy to relay those to Jen at the end of the webinar.
Wonderful. Thank you so much, Susan, and thank you so much to everyone for having me. So I'm really excited to talk today about this topic, which is really a passion of mine. And I have to say the timing was a little bit serendipitous. So I attended now 2 weeks ago a medical leadership conference for Reach Out and Read. And I think the reason I mentioned that is because it really gave a lot of additional context for promoting reading and literacy and parent-child relationships in medical settings, and I think has informed a lot of what I'm going to talk about today. So some of the things we talked about at this conference before the Pediatric Academic Society meeting in Boston was clinician experiences with Reach Out and Read, how to promote reading during clinical interactions, selecting books, children's literature, and really thinking about the neuroscience of reading, and then how to promote Reach Out and Read in the NICU. And I think like this meeting really had a lot of people who were there over the 30-year history of this organization. So this idea of promoting reading in medical settings is relatively new. And I think thinking about the historical context of this is important as we think about expanding these efforts, which have been historically done in pediatric primary care to the NICU. So I'll start with, this is from a 1990 commentary written by Robert Needleman, who was the co-founder of Reach Out and Read, which began at Boston Medical Center. So the safety net hospital where I now work, it began in 1989. And at the time, this idea of promoting reading in medical settings was really pretty novel. And so what Dr. Needleman said is since the 1955 publication of Why Johnny Can't Read, controversy concerning literacy has raged among educators, parents, and politicians. Pediatricians, for better or worse, have been kept out of the fray, confining their efforts to early detection of language and learning and disabilities. No longer. He said there's now an estimated 23 million illiterate Americans, and pediatricians are increasingly faced with reading failure and its consequences. So what he proposed is, in a field already crowded with professionals, pediatricians have a special contributions to make, not only toward diagnosis and management, but also toward prevention. And this was really the beginning of thinking about what is the role of pediatrics in literacy promotion. And just a very brief aside that I couldn't help but mention is, so he talks about this 1955 book, Why Johnny Can't Read, which really focused on phonics as an essential component of reading promotion. And I think it's just fascinating to see kind of how the pendulum swings. So that was mentioned. Now, he mentioned this 30 years ago, and more recently in the news, there has been a lot about how we really do need to be including phonics in reading instruction, and how you might have heard in the news about the transformation of Mississippi schools and the educational system. And a lot of this was integrating phonics back into reading instruction. So that is not at all the topic of this presentation, but I just thought an interesting little aside given the historical context. So back to these first studies about reach out and read. So these were kind of the two big initial studies that Dr. Needleman did. And the first, published in 1991, was a pilot study. And they did a clinic-based intervention for children 6 to 60 months. And what they did to encourage reading in pediatric primary care settings was they had people reading in the waiting room. They provided guidance about literacy development from the pediatrician, and they provide children's books at visits. And so this was really one of the first studies to show that pediatricians in the medical system could play a role in literacy promotion, and that this impact was potentially greatest among children experiencing poverty. And then this was then followed by a multi-center study, which there were convenient samples of parents of children 6 to 72 months before and after Reach Out and Read implementation at 19 primary care sites in 10 states. And this intervention was associated with parents being more likely to name reading as a favorite parenting activity, reading aloud at bedtime, more frequent reading aloud, and then more picture books in the home. So I think this really was among the first evidence that pediatricians in medical settings are really important in supporting reading. And some of the mechanisms that have been suggested to be responsible for Reach Out and Read's effectiveness are this idea that the primary care platform where Reach Out and Read has previously been implemented is a really great platform to access families, that the pediatrician is a trusted voice, that there's strong relationships between pediatricians and families, that this intervention involves modeling of shared reading. So it's not just giving out the book, and it also increases the number of books in the home. And so moving forward a little bit to 2024, so this is Perry Klass, who's the National Medical Director of Reach Out and Read, who's at NYU. And I would say that she has been really instrumental in communicating the science of why literacy promotion matters for pediatrics. And this resulted in a 2024 policy statement from the American Academy of Pediatrics. And so then some of the more recent developments have been expansion of the Reach Out and Read model to less than 6 months. So previously, Reach Out and Read has been implemented at 6 months, and there really was this awareness that it needs to start earlier. And so this resulted in the Building Connections Begins at Birth initiative, which really emphasized that reading starting at birth, it provides a really special time for caregivers to spend with their children, and that we really should be promoting this earlier on. And then the second big development recently has been this focus on supporting early relational health. So the American Academy of Pediatrics has really been at the forefront of this paradigm shift where instead of thinking about adverse childhood experiences and negative effects of early childhood experiences, we're really trying to turn that into a more strengths-based paradigm to focus on early relational health or strong parent-child relationships. And this really was highlighted in the 2021 policy statement from the American Academy of Pediatrics. And so just to define early relational health, this is an organization called Nurture Connection, which is one of the leaders in really convening organizations focused on early relational health across the United States. And they define early relational health as a state of emotional well-being that grows from emotional connection between babies and toddlers and their parents and caregivers when they experience strong, positive, and nurturing relationships with each other. They highlight that it's foundational to healthy growth and development. in their parents and caregivers' sense of competence, connection, and overall well-being. And that these strong and enduring relationships also help to protect the family from the harmful effects of stress. So there's this idea that strong early relational health, which shared reading can promote, can really help buffer some of the effects of early life stress, which I think are particularly evident in our population in the NICU. And so resulting from this, in the past couple of years, partially coming from the policy statement issued by the American Academy of Pediatrics. Excuse me one second. Sorry. So they're Reach Out and Read, and then the American Academy of Pediatrics partnered together to develop this early literacy toolkit. And the idea was to really translate these recommendations from this early literacy policy statement into tools for both clinicians and then also for parents. And so I was really fortunate to be part of a group that contributed to recommendations for how do we support reading both for among NICU staff and then among parents. And so I'm going to share some of that work later on. But this is just really to highlight that this is really the moment when all of these forces are really coming together. And I would say the moment is here for supporting shared reading and early relational health in the NICU. And then as evidenced by this, so on the Vermont Oxford Network annual survey in 2024, 374 NICUs, so nearly half of those studied, reported that they had a reading program, such as Reach Out and Read. So these are really being implemented in NICUs across the United States. And in terms of the relevance to our NICU population, so this was a study that looked at early literacy outcomes among children in Wisconsin. And so it looked at preschool age early literacy outcomes, and it was things such as rhyming, alphabet knowledge, letter sounds, word concepts. And what they present here on the y-axis is the probability of meeting the school readiness benchmark. So closer to 1 is better because you have a higher probability of meeting the readiness benchmark. And what they did is they stratified the results by insurance type and then maternal education. And then along the x-axis here is they show gestational age. So what they really saw is that there's a modification of the effect of gestational age by maternal insurance and then education. And so what this shows, the relevance to reading is I think it's important that reading interventions and early literacy can really be interventions that can be important for promoting health equity in the NICU. And then this was also another thing that I think people wonder about is, well, we've had a lot of advances in neonatology recently, and haven't reading outcomes changed according to these advances? And so what this was a systematic review and a meta-analysis of English peer-reviewed articles. And they included articles that included a sample of preterm or low birth weight children who were 5 to 18 years old, born during or after 1980, studies that had a term comparison group, and then assessed academic outcomes by validated standardized tests. And they broke this down into 3 eras based on decade. I guess the first 2 are decades, and then the last is a little bit longer. And really what they found is that despite these advances in neonatology, that there continue to be reading and math deficits in preterm children compared to term children. So I think this all highlights that literacy promotion is really relevant for babies in the NICU. So in terms of what I'm going to talk about today is some of the evidence for shared reading in the NICU and then after discharge home. And then I'm going to talk about the Reach Out and Read NICU core components, which are a framework for implementing NICU shared reading programs. I'm going to talk about some practical considerations for NICU shared reading programs, propose what I think are some of the next steps in terms of research and programs. And then I think that we're going to have time for questions and discussion. So I'm really excited to hear additional feedback about this and how it aligns with what you think the implications are for your NICUs. So starting with evidence for shared reading in the NICU and after discharge home. So I presented a little bit of the rationale for NICU shared reading interventions. And so now I'm going to talk a little bit about what are some factors that are specific to the NICU that really make the case for these shared reading interventions. So the first is thinking about there's really different language exposure in utero versus in the NICU. And so I think this particularly applies to preterm infants who, instead of having time for this language exposure in utero, are instead in the NICU. And so the main difference is that in utero, the sound is attenuated by the amniotic fluid in the maternal tissue. And babies hear mostly low frequency, or fetuses hear mostly low frequency sounds. And then there's this consistent exposure to the maternal voice. So it's a single voice versus multiple voices. And there's really a variety of language in the maternal environment. And then what differs in the NICU is that there can be lots of loud alarms. There's a variety of voices in the environment. And then they found that there's less infant-directed language. And then also that there's a lot of evidence that the language exposure varies in private rooms versus open bays. So I think this is very much still up for study, thinking about this, because there can be some benefits for clinical stability in private rooms, but it does seem that the language exposure in terms of sheer number is greater in the open bays. And then this study looked at the effect of maternal voice on infant heart rate. And the reason why I present this is because I think it really shows the evidence that babies, even at the youngest gestational ages, are really responding to the maternal voice. And so I think this is really important evidence for families. So this was a small study of 20 hospitalized preterm infants who were born at 25 to 32 weeks gestation. And at the beginning of the study, their postmenstrual age was between 26 and 33 weeks. And so what they did is they recorded the mother's voice and the heartbeat to simulate the auditory exposure in utero. And then they replayed the recording for 30 minutes, 4 times a day during infant care times. And so what they did overall is that the red you can see with the without the maternal sounds, and then the blue is with maternal sounds. And what they found is that there was a significant decrease in heart rate with the maternal sounds. And then they were wondering, they said, respiratory support or caffeine would be other factors that could affect infant heart rate. And so they did subgroup analyses and still found that these effects were significant. And then they also looked to see if there were infant factors that affected the magnitude of heart rate response, and neither birth gestational age, birth weight, 5-minute APGAR, or postmenstrual age were all non-significant. So I think this really highlights to families that really for all babies in the NICU, that maternal voice is really important for babies and can provide soothing effects. And so the next thing that I think is an important rationale for NICU shared reading interventions is early relational health, which is something that's been a big focus of mine that I'll present some research on, because I think it really highlights just that this is a population that we need to think about interventions such as shared reading that can promote early relational health. So there's several proposed mechanisms through which preterm birth can affect relational health. So there's parental stress and trauma, There's parent-child separation that can last a really long time during prolonged NICU hospitalizations, and particularly if there's geographic separation between where the family lives and where the NICU is located. There can be painful procedures in the NICU that can affect the baby. There can also be different developmental expectations. So a family might have expectations for a certain developmental trajectory and need to adjust that, which can affect parents' relationships with their babies. And then similarly, babies in the NICU can, after discharge, can have medical conditions or developmental conditions that can affect parent-child relationships. And so there's been some research on early relational health interventions in the NICU. And so this was not a shared reading intervention, but it was an intervention at Columbia that they were called calming sessions. And really what they did is it was to promote the relationship between the parent and the child. So it was this structured approach of fostering the parent-child relationship that could either be conducted skin to skin or with the infant in the isolette. And really, the goal was to promote infant-directed emotional communication while the infant was in the NICU, and then with as much eye contact with the parent as possible. And so what you can see is that the red was the infants who received these interventions, and then the blue was the control group. And then you have over here the time when they started the family nurture intervention. And then you have their heart rate on this axis, and then the time in the NICU on the other axis. And really what this found is that there was greater autonomic stability among infants who were exposed to this intervention. And so thinking also about the parent perspectives on early relational health. So one of the things that I was interested in is how do these perspectives what vary among parents after NICU discharge. So there's been a lot of information, research done on early relational health during the NICU hospitalization, but what about after discharge? And so what we did is our aims of this study were to look at perceptions of behaviors that are associated with early relational health, such as responsive parenting, household structure and routines, and then warm parent-child relationships, and then to identify barriers and facilitators to these behaviors. And the study population was English-speaking parents of children born less than 34 weeks who were less than 3 years old at the time of interview. We included families with public insurance because we wanted to understand the experiences of low-income caregivers. And we recruited from 3 clinics in Boston. And so we conducted in-depth semi-structured interviews and then used a deductive qualitative approach to analysis. And so our study population, we had babies who had been born at 24 to 34 weeks, and the corrected age ranged all the way from 0 to 35 months. And then we had a variety of racial and ethnic backgrounds. We also had 4 parents of twins, and then 2 parents of children who had medical technology, such as a tracheostomy or G-tube, and 15 parents reported that their children received early intervention services. And so I'm just going to present a sample of our findings that are relevant really to thinking about perceptions of early relational health among the NICU population. And so our first major theme was that parents' perceptions of preterm birth affect their relationship with their children. And this was true really after NICU discharge when we interviewed families. So one of the parents said, in sum, I feel like she needs me a lot because she was born a preemie. She needs the extra attention. I don't know how to explain it, but I feel like she needs me more than she would have been full term. I need to pay attention to everything so I don't miss it. And so I think this really highlights that parents are really thinking about prematurity as they think about their relationship with their babies, even after NICU discharge. And similarly, parents highlighted specifically the experience of having a baby hospitalized in the NICU and needing to have heightened attention to their children's needs after discharge. So this, a mom of a child who was born at 31 weeks and was now corrected to 4 months, said, I always have it in the back of my mind that this was a season where I wasn't able to be with my child. And so I think my sensitivity to her in terms of attending to her needs urgently stemmed from that, because having to leave your child in the NICU is very, very difficult. And so I'm always around her just to make sure that she's okay, because there was a point in time when I wasn't able to. And so that can be hard. And so I think what this highlights is has really important implications for supporting early relational health after NICU discharge, but it also makes me wonder about things that we can do in the NICU to help support these parent-child relationships, and whether shared reading interventions can be something that can accomplish this. So in terms of existing shared reading interventions, I think there are some studies that show the impact of these, and I'm going to present a couple of these. But one thing that I'll highlight is that these interventions are really heterogeneous. So even though later on I'm going to present the Reach On and Read NICU core components, and that's some expert consensus best practices, there really is a need to figure out exactly what is what are the best components of these interventions. So this study was from a group in Montreal, and their intervention was called Books for Babies, where nurses chose a book from the NICU library, and the books included a letter to parents detailing the benefits of reading. And the nurse suggested that parents read to the baby for a few minutes a day and assisted them to do so. And then they were also encouraged to take books home and then read after discharge. And this was a non-randomized intervention with a historical control group, and then they surveyed parents 3 months post-discharge. So what they found was that there were significant increases in reading, more frequent reading, and then naming things such as reading as an activity of shared enjoyment and something that helps parents feel closer to their baby. One thing that I think is really interesting is they actually did not find a significant difference in families responding that they were advised to read by a healthcare professional other than in the hospital. So I think this really, highlights that we also need to think about the continuum of this and what kind of counseling are families getting after they go home. And then they had a free text question at the end of their survey, and they asked, is there anything else that you would like to tell me about reading with your baby? And so what families said, they categorized their responses into 3 themes: that reading provides a sense of control, a sense of intimacy, and then a sense of normalcy. So I think this is really important in thinking about what do these interventions mean for families. And so this is another intervention that was from a group at Vanderbilt, and this is called the Little Bookworms NICU Reading Program. And this one was a parent-led NICU reading program. And what they did is they provided access to books, they provided in-person education, and then written reminders about the importance of how to read with babies in the NICU. And then they supplied families with a reading log, which is shown here. And what they measured from this were outcomes of attachment and anxiety in both mothers and fathers. And so they found that there was significantly decreased self-reported anxiety for both mothers and fathers. There was significantly increased self-reported attachment for mothers, but that there were no significant changes in self-reported attachment for fathers. And so those are some of the NICU-based interventions. And I think another thing that is really promising is thinking about the use of technology or mobile apps to promote shared reading. And so this has been piloted a little bit in pediatric primary care, so not necessarily in the NICU. And this was from a group at Cincinnati, and it presented as an enhancement to Reach Out and Read. And the app included videos, parenting activities, and then some push notifications. And their control group just received a book that included reading tips. So they also received some sort of guidance, but not via the technology platform. And so what they found is that in terms of usability, that parents, thought the content was okay. They wanted a little bit more engaging, age relevant, actionable, and or updated content. And then in terms of efficacy, at 6 months, but not at 18 months, families were more likely to rate shared reading as a favorite activity. They didn't report any differences in reading interactivity. So things like pointing to pictures, talking about the pictures as you're reading together. And then there was greater parent-reported expressive and receptive language at 18 months. And then one thing I think you have to think about as kind of a balancing measure in this is about screen time, because as we know, the AAP has recommendations and guidelines for screen time. And actually for really young children, the recommendation is no screen time aside from video calls. And so they found that screen time was high among both of these groups and greater than AAP guidelines. And so I think there's some evidence that about these NICU shared reading interventions, but there's really a need for more evidence. So one of the things that I'm really excited that is coming soon, that I'm working with Susan on, is that we're doing a study where we're going to use a shared reading intervention as the attention matched control. So this is a study that's going to occur in 16 NICUs across the United States. And NICUs are either going to be randomized to a safe sleep quality improvement program or a shared reading quality improvement program. And then after discharge, they're either going to be randomized to a safe sleep mHealth, so it'll be a texting intervention with some videos, or a shared reading mHealth. And what we'll be able to do is to look at the effectiveness of each of these interventions individually and then also synergistically. So this will hopefully give us a little bit more information about what has the greatest impact on shared reading among the NICU population. And so now I'm going to move on to a little bit more practical considerations for implementing Reach Out and Read or reading programs in the NICU setting. And so first, I'm going to talk about the Reach Out and Read NICU core components, which really were adapted from the Reach Out and Read primary care program, which, as you might remember, was really focused on having reading and literacy promotion in the waiting room, and then was focused on providing books, but then also with the books, providing anticipatory guidance and modeling about the benefits of reading. And so I can't present these without highlighting that these are really the work of one of my colleagues and partners in crime on this, Catherine Caruso at Oregon Health and Science University. And what she did is she helped develop these core components and then also has piloted them in their NICU at OHSU, where they have a really successful reading program. And so she has really been instrumental in putting all this together. And so there's 5 core components. So the first one is providing a literacy-rich environment. So this involves having signage promoting reading. And really the goal is that anyone who walks into your NICU should really be able to tell, this is something that's really important and is valued in our NICU. And this is really good for babies in our NICU. And then books are a really important piece of this. So having books at the bedside, having a bookshelf or a lending library. Some NICUs have infection concerns around this, so that is something to navigate, but a lot of NICUs have been successful in having these libraries. And then also having a culture that emphasizes the importance of reading. So this is really something that it's not just the nurses or whoever else you decide is going to provide the books and the education, but it's like your whole NICU. So even, say like a sibling walks in, the unit coordinator who greets them at the front might ask them about whether they want to get a book to read with their younger sibling. And then I just wanted to make this a little bit bigger. So I actually saw this when I was on call in the NICU over the weekend. And I think this is just a really creative example of how to promote reading in the NICU. And it really nicely highlights this intersection between reading and early relational health. So a big part of early relational health is promoting kind of the parent-child communication and their relationship. And so I thought this was just really creative. So saying on April 12th, I decided I didn't want a breathing tube anymore. So I took it out myself. I scared the pants off the medical team, but they put me on NIPV, and I've been a good boy since then. Now I love sucking on my pacifier even more than before, and I am sure to let my nurses know when I've lost it and need it back. So I think this accomplishes actually a lot of the things that we want NICU reading interventions to accomplish. So the first is just this literacy rich environment, but then it also, I think, subtly is getting at the parent-child relationship and thinking about what is the child thinking and how are they communicating that. So I just thought this was really creative and wanted to share this. And then the second core component is staff education about shared reading. And this really comes from the Reach Out and Read primary care model, where training is really central to Reach Out and Read success. And so there has been a pathway training that was developed by Reach Out and Read that provides a lot of really good resources about the rationale for reading programs and how to talk with families about reading. And then I think there's really a need to identify the best modes of training and who should be trained and how much, and should there be different types of training for different roles in the NICU. So if your NICU decides that a certain role is going to be the one who's going to be responsible for providing the education about the books, what about other people who interact with families? Could they benefit from a different type of training that might not be as lengthy so that they could also contribute to a literacy rich environment? And then the third core component is having a regular schedule of book distribution. And I think this is where we've really thought about how do you adapt this from primary care? Because in the primary care model, it's kind of simple that you just follow the primary care well-child visit schedule, because that's when kids are going to the pediatrician. In the NICU, we really don't know what the right dosage is, and that's something that I think really needs to be studied. So the recommendation currently is to distribute books every 2 weeks and to use book logs for tracking these. So I've included here, this is the log that they use at OHSU, an example. So they have when is the book due, and each baby has their own log. So it has the due date, when the book was given, what the title of the book was, and that's important so you're not repeating books. Was education provided to the parent? And then who completed the log? And I think this is something that likely can be really individualized to individual NICUs, and there might be roles for using the EMR here. And then core component number 4 is education about benefits of shared reading. And this is the idea that this education should really be distributed with book distribution and then also as part of developmental care. And it should cover topics such as language development, bonding, the long-term benefits of reading for babies in the NICU, how reading can contribute to stress reduction for NICU parents, and then also how reading can affirm the unique parenting role. So I think one of the things we hear from families is that in the NICU, I'm told, I don't know how to feed my baby. I don't know how to give my baby medication. I don't know how to soothe my baby. And they're like, reading is something that I really need to do, or I know how to do. And so I think this is an opportunity where we really can build that up. And then the 5th core component which we've modified a little bit from the outpatient read out and read model that really focuses on modeling, is education about shared reading strategies. So this can include things such as reading in the NICU environment. So how do you read with a baby who's on respiratory support, who's in an incubator? What about parent comfort? There's a lot of qualitative work that says that parents, say that they might feel uncomfortable reading in open bays. Like, what if someone hears them reading to their baby? And then also just that the chairs might not be comfortable for reading with your baby, or there might not be space. I think also reading with babies who are preterm or who have neonatal medical conditions. So assessing for overstimulation and reading the cues of the baby to assess how they're responding to reading, which I think is part of developing early relational health. And then also strategies to make reading fun and exciting. So using silly voices, talking about and asking questions about what's happening in the pictures, involving siblings. And then the other thing is that the most important thing at this point is the parent-child relationship and engage. It's really a special time together and the language exposure. So if the parent wants to read books that are interesting to them, that's great. I've even had a parent who said that he thought all the baby books were boring and he wanted to read the Wall Street Journal to his baby because that's what he wanted to read. And that's great. It accomplishes what we want to accomplish with this. And so then thinking about some practical considerations for NICU shared reading interventions. And I think this is just a selected few. There are a lot of things to think about in terms of implementing these interventions in the NICU. And I'd love to touch on this more during the discussion. So I mentioned this a little bit before, but we should really consider books that might be intended for older babies rather than board books that have a single word on the page. And if you think about this developmentally, it's really important for an older baby to be able to handle the book and maybe put the book in their mouth. But at this age, you really want an engaging story that the parent and the baby can share enjoyment in together. Parents can read books that they like, or even the newspaper. Books should really be available in multiple languages. And then both books, and I would argue also strategies for talking with families, should think about parents with various literacy levels and reading experiences. So it's totally fine to have books that just have pictures and don't have any words. And parents could work on telling stories about what's happening in the pictures. And then Reach Out and Read in the primary care space does really involve families in the book selection process. And so I think that is something to consider for the NICU. And then people often ask about topic-specific books. So ones like about being in the NICU that might be specific to that experience. And I think, those are great too. But this is, when you think about these books, this is really about like sharing a story together. So I think just acknowledging that those topic-specific books might be a nice adjunct, but might serve a slightly different purpose than the other books that are more like stories. And then this was from the study at Vanderbilt. And they, interestingly, in their study, they got book recommendations from NICU parents. So they really, you might recognize on here some old favorites that they suggested. And then they also, said things like books that I liked when I was little, books that are interactive. And a lot of parents say too, like books about families and showing, like to promote the relationship, showing how much your baby means to you are really important as well. And then they mention for certain families, Bible stories, and then adult chapter books. And I think the adult chapter books is not one that we necessarily think about in terms of a NICU library, but could be an interesting thing to consider based on this feedback from families. And then this idea about modeling. And so getting to this, like a really important part of the outpatient reach and read model is that there's this modeling of this book interaction with the families. And I think it's not necessarily that you're like showing the family how to read, but it's you're pointing out things like, as you give the book to the child, you're saying, oh, what do you think is happening in this picture? So you're supporting that idea of using the book as a tool for shared engagement. And I talked a little bit about how in the NICU that some families feel like they're being told that they don't know how to do all these parenting things. And so reading is one of the things that families actually need to do. And so that, or know how to do. So that was why we had adjusted to really showing strategies versus modeling. But I think, we really need to think about an individualized approach. So how are we supporting parent autonomy in the NICU while also empowering parents with strategies and then leveraging these trusted relationships that we can use to provide advice. And so one mother who we interviewed about this said, I think it would depend how they worded it. If it was like, studies have shown that you do this, this makes it even better for their brain, I would be like, oh, great. But if it's like, I'm going to teach you how to read to your child, I'm like immediately insulted. And then I thought this was also helpful thinking from mothers about perspectives on talking to families about reading. And so I think the first thing is to really acknowledge that families can feel like sometimes that people are watching them as they're reading. And so this one mother said, you almost do feel like there's someone watching. You don't want people to see you break down. You don't want people to see you get stressed or overwhelmed because you don't want them to judge you or feel like they are judging you. I think it's hard, like you said, to create an environment where you say, yes, we want to provide this opportunity. And then I thought this next quote was great because it just emphasizes how simple it can be. She said, maybe just have the nurses ask, would you like to read a book to read? Reading to the babies is good. Would you like to do that today? Or when would you like to? And so moving into some of the next steps for research and reading programs, I think some of the research questions on my mind are really to think about the long-term impacts of the child, parent, and then didactic or early relational health outcomes that are impacted by these reading programs. So there's strong plausible evidence, but I think we don't have that evidence of what the impact actually is. And I think that I'm excited that we have the opportunity to generate some of that evidence, thinking about the mechanisms, like what are the parts of these programs that are really the most important? And then how do we continue to support shared reading that is tailored to the specific needs of NICU families after discharge home? So we know that NICU families are still thinking about how the NICU hospitalization might impact their relationship with their baby. And so how do we deliver a reading intervention that accounts for that? And then also just the dosage. So how often should we be giving out books and talking to families about reading? And then some of the programmatic innovations that I think we need to think about is that families have really different experiences with reading. So some parents love to read. Some parents don't have positive experiences with reading. Some parents have been reading with their babies all of pregnancy. Others don't think about reading with their babies in the NICU. So how do we really use a strengths-based approach to support all of those groups and to identify what families need? And how do we train staff to support families who have these different experiences? And then I think also we need to think more about book selection and really what are the best books for reading with babies in the NICU, and how do we create NICU environments that are really comfortable so that families want to read. So I have many acknowledgments, and many of the funders who have funded some of this research, and then also the rest of this very large and mighty study team. So thank you so much, and I would love to hear questions or ideas for this.
Thank you so much, Jen. That was awesome. You know, when I think about my general pediatrics residency days, reach out and read and just reading in general was such a part of anticipatory guidance that was provided. And yet in the NICU, certainly not in fellowship and not even now in my faculty years, do we talk much about it at all. And I can't think of a population that could benefit so much from all that you're highlighting. Let's open it up for some questions. Feel free to chat in or unmute yourself, and maybe I can get started. You know, you mentioned a bit about the post-discharge period. Do you happen to know if programs like early intervention or other post-discharge programs for high-risk infants are integrating shared reading as an approach?
I think it completely varies. At least in Massachusetts, early intervention is like really guided by kind of what the families, wants to focus on within that program. So I think what I've heard from a lot of early intervention providers, particularly for preemies, is that there's a big focus on the motor development in early intervention. And I think that makes a lot of sense because those are the deficits that might present more quickly, and babies could have like torticollis coming out of the NICU. But I think there's a big opportunity to think about how are we supporting motor development within the context of the parent-child relationship, because you could do activities that are both supporting that domain of development and fostering the relationship, and maybe building that parent like sense of competence as you're doing that. And I think, shared reading could be something that could be a tool for that. And then another thing that like Reach Out and Read has really thought about is what is the continuum of this? So it's like you're talking about reading in the NICU, and then you're talking about potentially reading in pediatric primary care, but what is the bridge between those two settings? And then should NICU follow-up, for example, be promoting Reach Out and Read, or promoting literacy through a Reach Out and Read model?
Yeah, I
Right.
see Laura Stern's comment. Awesome that St.
Yeah.
Francis has a library. That's fantastic. Other questions
I
for
have a
when?
question. I have two
Sure.
questions actually. One, will this recording be disseminated to us? I would love to share this with our NICU nurses. And two, how do we start, or how do we get a Reach Out and Read program started within our facility?
Yes. So the reach out that you are asking, so yes, I'm happy whatever process you have, Susan, for disseminating the recording. And you are asking about the Reach Out and Read program at like the perfect moment. And the reason for that is, so there was this initiative probably 5-ish years ago to really adapt the Reach Out and Read model to the NICU setting. And I think one of the challenges through that was, so Reach Out and just to back up, Reach Out and Read is like a nonprofit that works with primary care sites. And there was some of the challenges around the tracking of the data from the NICUs, because it requires really different procedures than in primary care. So at this exact moment in time, there is a pause in enrolling new NICU programs in Reach Out and Read. However, at this like meeting, there was basically huge interest in thinking about ways to kind of redesign this model to fit the NICU setting better. And I think part of that is that, at the like this pilot program only included 10 NICUs, but then when I showed the Vaughan data, there's like 400 NICUs that have reading programs. And so I think if you reach out to me, I'm actually going to be working with a national group through Reach Out and Read. And we're both going to try to support NICUs that already have reading programs, and how can we best support that, but then also NICUs that want to implement new programs. So really good timing.
Can you put your contact information in the chat?
Yes, I'm putting it in there right now. And
Fantastic.
I think like there's just, it's really just thinking outside the box for this. Like this is a moment, I would say, where it's a really exciting time where the Reach Out and Read National Organization is saying, what do NICUs want in terms of supports to implement these programs? So I think we have this really exciting opportunity.
Other questions? Now, the issue of family presence in the NICU, I know is one that we talk about a lot. A lot of the work that we do in the NICU to promote this dyadic development is limited by a whole array of factors that influence parental presence. And so, curious to know if there are innovative strategies that you or your team have thought of to promote this interaction when families cannot be at the bedside as often as they want.
Yes, I think that this is like so critical and really thinking about this for shared reading programs. So I think this is like a balance between we really want like there's you want you want families to have books and you want babies to hear additional words. But then the third part of this is that you also want the families to receive the education about the benefits of shared reading. So I think a lot of these strategies have focused on how do you provide the books when the parents aren't there, and that's not that hard. You put the book at the baby's bedside, and then there are some voice recording interventions, so things like parents record themselves reading a book to their baby, and then that can be played when the parent's not there. But I think this education piece and the modeling is something that we really need to think about differently. And I think it's not that different than how we think about all the topics of parent education and engagement in the NICU. And so I wonder if there's opportunities for we could use videos in the NICU for promoting reading, or even when nurses are calling families or families call about updates, if reading could be part of those conversations. So it's really just embedding it into everything. And then the other thing that came up around this is I didn't present some of this data, but we also interviewed NICU staff about the Reach and Read core components. And one of the things that we heard about reading with babies whose parents were not present was that staff felt like that was something that was sometimes too intimate and did not feel comfortable doing that. And then some parents said they would not want families to or staff to read with them when they're not there. Some families said they would. So I think that's also just something to ask about, because that could be a role for volunteers, but it doesn't address the issue of the education.
Yeah, that's so interesting. I think we on the healthcare side think we have these great ideas, and then it comes to implementing them. It's not always what the families want, or at least not in the way that the families want it.
Right. Absolutely.
All right. Well, thank you so much, Jen. This was so great. I can almost imagine that for the next year, our defined focus may be reach out and read or shared reading. For this year, it's improved communication, but all of it is so related.
That's awesome. Thank you so much. Yeah, and I would love to hear from anyone who is interested in implementing a reading program in their NICU.
Fantastic. Well, thank you all for joining. I hope everyone has a great afternoon.
All right. Take care.
Bye now.